Hello, Dr. Vicki Peterson here. I want to talk to you today about a condition that I'm seeing more and more, all ages, both sexes, and it can be very debilitating, yet people are not diagnosed, they're misdiagnosed, they're given dangerous drugs, and even if which I'm going to tell you the name of the condition, but even when I do, most people will have never heard of it. They don't know what it means. And so I won't keep you in suspense. It's called a hiatal hernia. A hiatus is just a hole. A hernia is something protruding through a hole that it shouldn't be. And so in this particular case, we have the stomach. Your mouth is connected to your stomach via the esophagus, the long tube. And the stomach is supposed to be below your diaphragm. So if you see where your rib cage is, the diaphragm are two dome-shaped muscles that as you inhale, bow downward, and then as you exhale, they bow upward. And they have this excursion that they do, meaning movement that they go through as you breathe. And the stomach is on your left side, and it's below the diaphragm, and so of course the diaphragm should be able to move without the stomach being in the way. And what happens with a hiatal hernia is there's different types. So you can have a very gross hiatal hernia that requires surgery because the stomach can get strangulated and it can be kind of a life and death situation. I have never run across that. It's very, very rare. You can have a mild hiatal hernia where the stomach is pushing up through the esophagus, through the diaphragm, and so it's pushed up, and it tends to create acid reflux, a feeling of fullness, a lot of burping. But it doesn't even have to be a mild hiatal hernia. It can be what's called a sliding hiatal hernia, which pushes up and then it goes back down, and it pushes up and it goes back down. That is the most common type we see. I also call it a subclinical hiatal hernia because it's very often missed even if you're looking for it. Most doctors, the general agreement is that hiatal hernia doesn't cause much in the way of symptoms. There's no real treatment for it, and patients are told, even those who it's found on, are told, no, that can't be the cause of your symptoms, which I completely disagree because we are resolving said symptoms all the time. So what are the potential symptoms? There's a long list. Now I have a free ebook on my site, and it's all about hiatal hernia. So if you go to rootcausemedical.com, you can do an in-depth with that. But the odds are, if you don't suffer any of these symptoms, you probably know somebody who does. And so for that reason, I just really want to talk more about it, because what can happen when that stomach is pushed up on the diaphragm is that, of course, the diaphragm is not moving as freely as it should, and that can result in a few different feelings. You can feel short of breath, so all of a sudden you'll just take a deep breath for no reason, or you just notice you're not getting enough air. That can translate into a feeling of anxiety. So if you're not getting enough air, meaning, because that diaphragm can't move as freely as it should because the stomach's pushed up against it, your nervous system registers the fact that you're not getting enough air, and it can give you a feeling of anxiety. And there's nothing worse than this sort of feeling of dread or anxiety, and you look around and you go, what? Life is not doing anything to me at the moment for which I should feel anxious, but I'm feeling anxious, so what does that mean? And then for some people that can really escalate and turn into a panic attack. The other thing that happens is, of course, while we're sitting up and walking around, gravity tends to pull everything down. So even though that stomach is pushed up, it's not nearly as bad as when you get horizontal to sleep. So now gravity can't help you, and so that pushing up of the stomach feels worse, and people can wake up in the middle of the night and gasping for air. They don't know why, and depending on the person's demeanor, that can escalate right into a panic attack and rushing to the ER. And so, or it just can really disturb your sleep because your nervous system keeps waking you up because it knows you're not getting enough air. So you just have disturbed sleep, but maybe not a flat out feeling of having a panic attack. So it does that. Because the stomach is pushing up on the diaphragm, the stomach tends to be in spasm, so you can get heartburn, you can get acid reflux or GERD, so you can have been diagnosed with that. Some people, interestingly enough, don't notice any digestive complaints. They just have a feeling of pressure in their chest. Again, the shortness of breath can be there or not. Any of these symptoms can be there or not, but there's a very long list of them. So the combination tends to be unique to different people. But I've definitely had patients say they had feeling like there was something up with their heart. Because the other thing that can happen is you can get heart palpitations, feeling your heart in your chest, and yet, you're not running or exerting yourself, but you're feeling these heart palpitations, and it's very disturbing because now of course you're going to the cardiologist and saying, what's wrong with my heart? And what's happening for these individuals is their lungs are checked out for the shortness of breath or this heaviness in their chest, and their heart is checked out for the shortness of breath or the heart palpitations, and they're told they're fine. And their heart and lungs are fine. That's actually very true. But this cascade of symptoms, it's what is being missed. Very often people have, if they don't have frank digestive complaints like the acid reflux or the heartburn, if you dig a little, you'll find digestive complaints. Constipation is a very common one. So, and sometimes it's not that people aren't moving their bowels once a day, but they have to bear down, they have to sort of strain a bit to move their bowels. And what that does is it increases the pressure in the abdominal area, so it's called the intra-abdominal pressure rises because you're bearing down, and you can kind of feel it if you bear down. And because that stomach's a little bit in spasm, as that pressure increases, it pushes the stomach up higher. So and this can be going on, of course, for years where the constipation is an issue and it's been increasing the pressure. Sometimes women who have just had a child develop a hiatal hernia because everything gets kind of squished, making room for baby, and then after baby it doesn't all settle down. So long list, as I said, right? So I wanted to give you an idea of two young men who I just saw in the past 24 hours and their little story. So I'm going to look at my notes a little bit as I do this. But one young man had the shortness of breath, had the anxiety, this feeling of anxiousness, which he's had for quite some time. He gets decent sleep, so he can sleep through the night, but he doesn't feel rested. He feels like he didn't really sleep and he's tired a lot. Does have a history of constipation, has a history of GERD, the feeling of the stomach acid coming up, either that or heartburn. It goes back and forth, and all he's ever been offered is an antacid. And then he actually has pain, so where the rib cage, the bottom of the rib cage, he actually notices some discomfort. Some people describe it as tightness, but they feel that tension from the diaphragm not moving so well. So he was actually in that category. The other young man, even younger, these are both gentlemen in their 20s, is quite an elite athlete. He's a semi-professional athlete, and he notices the stomach pain, also had shortness of breath, also anxiety. His insomnia is very intense, such that he has a lot of trouble falling asleep because he's got this anxiousness and kind of mind racing feeling. So it takes him more than an hour to settle down. But then after 4 to 5 hours, his body wakes him up because of shortness of breath. So that is another manifestation of this. He does have some chest pain. He has shortness of breath, and he's a professional athlete. So he's in a very elite condition, yet the shortness of breath is really impacting his ability to be athletic. He said when he's really pushing through like a match, he doesn't necessarily notice it as much, but as soon as he stops, or sometimes mid-match, he kind of just hits the wall and his body shuts down. Also has this issue with constipation. So what has traditional medicine done for these young men? the second one doesn't have a lot of digestive complaints other than just some stomach pain. And it's like, well, don't overeat and don't eat so fast. And, we've checked out your heart and there's nothing wrong with it. Really offering nothing. And both these young men, their lives are severely impacted. The anxiety is very key. One dropped out of school, the other one's having trouble at work. So it's an interesting combination of symptoms, right? And so this is something we see a lot. I spoke to a gentleman yesterday from across the country, same thing. And it's certainly not exclusively men or women. We see both. Just happened to be in the last 24 hours, 3 men. But this situation is very, very impactful, very easy to correct, to get to the root cause. And it's mostly digestion and analyzing what's happening in the digestive tract as a whole. But there's also sort of a structural aspect of it to break that. The diaphragm can be in spasm, and break that spasm of the diaphragm, which is more of a physical therapy type of procedure. But the biggest thing is getting to the root of this gut-brain connection and normalizing how the gut is functioning. And that's what we do here at Root Cause. So if you know anybody with any of these symptoms, please let them know about what we do here. We do see patients from across the country, and I tell you, it's becoming epidemic. Why is it becoming epidemic? I think it definitely stems from our poor diet. That makes a lot of sense. But it's so correctable, so very correctable. And I've seen patients suffer for so long with it, and it can really, really impact lives. So if you know of anybody with any of these symptoms, please tell them about us. I'm happy to do either a phone consultation or an in-person consultation. So have them give me a call here at the clinic, and the number is 408-733-0400, or visit us at the website rootcausemedical.com. I'll see you soon.